with Dr. Alamani, oncologist from Florida Hospital Cancer Institute, and he's going to share with us some information on breast cancer awareness. Thank you for meeting with us today and taking the time.
Thank you. Thank you for inviting me.
Can you start off by telling us a little bit about yourself and why you chose oncology?
I'm a medical oncologist. I've been doing this for 10 years. I am originally from Puerto Rico. I trained up in Cleveland, Ohio. And after 6 years in the North Pole, I decided to come down to warmer weathers. I've been doing oncology ever since I saw the first oncology patient, who turns out to be actually a family member. So I got inspired very quickly by my father's oncologist back home. And then from then, I've never looked back. I've always been taking care of cancer patients.
That's awesome. This might seem like a simple question, but what is cancer and what causes it?
Cancer is basically a growth or irregular growth or erratic growth of cells that do not respect our body. They're not supposed to be growing there. Our body is supposed to clean and clear them out. And unfortunately, they're able to disguise themselves, and our immune system are not able to clean them out.
Okay. Can you share with us the importance of taking preventative measures, getting screenings regularly?
It is very important. I think the screening measures that we have so far in this country have saved so many lives. And if you compare the statistics of 20 years ago compared to now, you'll see that most cancers that actually we screen for, we actually have dropped that mortality rate significantly. So it's very important to follow recommendations for breast cancer screening, colon cancer screening, prostate cancer screening, and others.
Okay. Is there anything a person can do to reduce their chance?
Yes, unfortunately we cannot deny our genes, so unfortunately when there's a genetic predisposition for cancer, you still can do things to avoid getting cancer, like for example, drinking excessive amounts of alcohol, smoking cigarettes, poor healthy diets, like for example, very fatty diets. Those are diets that potentially can lead you for cancers. So those are the things that you could do to try to avoid cancer.
Okay.
As well as vaccinations, like for example, the HPV vaccination is available. Is given to children ages, I think it's 16 all the way to 26. That could potentially prevent a lot of cervical cancers, head and neck cancers, you name it. That actually could be a major impact in our society.
That's good to know. What is the current statistic on a diagnosis of breast cancer? And is it unique only to to women?
It is not unique to women. It can happen to men as well, although it's right around 2 to 5% of the cases actually are men, so the majority are women. Statistics are it is the most common cancer in women, and thankfully it's not the worst in regards to mortality. So that means that if patients actually are able to get diagnosed fairly early, you have a chance of being cured.
Okay. Are there any new breakthrough treatment options besides chemotherapy?
Yes, so basically most of the breakthroughs have come from chemotherapy, immunotherapy, targeted therapy. So yes, over the last 5 years we have made incredible advances in medicine, and now one of the hottest topics in breast cancer oncology has been actually learning and fixing resistance to the drugs that actually work. So when the cancer becomes resistant to a drug, now we're able to somehow shut down the resistance, and that old drug that used to work, now it works again.
What determines the type of surgery a patient would have? Lumpectomy versus...
Great question. So lumpectomy versus mastectomy. So it depends, number one, the location of the tumor, number two, the size of the tumor, number three, the size of the breast as well, because sometimes even though you might have a small tumor, if the breast is actually too small in an area that is very visible, the patient will elect or actually even recommended by the surgeons to go ahead and get a mastectomy. Now nowadays it should be known that most patients that get a mastectomy, at least in centers like ours, they will get immediate reconstruction. Because in the old days they used to do a mastectomy and then you may or may not have a reconstruction, which leaves that woman with a significant social issue with no breast, and obviously they will feel not as normal as compared to somebody who has a reconstructed breast.
How do doctors decide whether or not a patient would need chemotherapy in addition to their surgery?
So in the old days, actually, everybody got chemotherapy. Pretty much it was a given. Nowadays, we are much more than that. Now, actually, we're able to choose the tumors that actually, or the patients that have the tumors that have certain genes that when on, that means that potentially are more likely to have a recurrence. So we are able to look at this 21 gene assays to make sure that we know who's actually going to recur or has a higher chance of recurrence, and we only offer the chemotherapy to those patients. So we don't just offer to everybody anymore.
Can you explain genetic testing for breast cancer and how evaluation and treatment of the disease is different for a population of patients who have strong family history?
Absolutely. So genetic testing is very important, especially for those that have what we call triple negative breast cancer, patients that are under the age of 50, patients that actually have more than one direct family member with breast cancer, or multiple breast cancers, or multiple cancers in the family as well. For example, colon cancer, prostate cancer, lung cancer, pancreatic cancer. So when we have such a situation, sometimes that simple genetic testing might not be enough. So we might refer those patients for genetic counseling. Genetic testing is very important. It can actually help not only that person, but also their direct family members.
If faced with a cancer diagnosis for yourself or a family member, what questions do you recommend asking your oncologist?
I think it's important to have a good relationship with the oncologist. I think it's important to always from the start make sure that you're able to hear all the information. So be receptive to your oncologist. Tell your oncologist, I would like to know everything that you know about this disease. Tell me where to look for more information in case that I wanted to look for more information. What resources are out there available for me? For example, support groups, or resources through the internet, or socioeconomic resources. So there's a lot of things out there that are available that when you ask for, potentially they could be out there for you.
If faced, well, what advice would you give your patients to help them make it through their journey? What's the
I think number
most
one,
important?
they need to have full confidence in their treatment team. If they have full confidence, they should be in a much better situation compared to those that actually are still struggling with trust issues or struggling with just following instructions. If the patient follows instructions, they will do 100% better compared to that one that doesn't do what we ask them to do. Again, I can offer you the best treatment in the world, but if you don't take it, it's not going to work. So very important for the patient is to have a positive attitude. If they have strong religious beliefs, definitely utilize all that to channel your energies to be a positive experience. More often than not, I have positive interactions with my patients and the patients with their families after diagnosis of cancer. So cancer actually brings families together. Cancer so many times actually help patients resolve issues from the past that many times they couldn't resolve. Now they're able to resolve them because they're facing potential death.
And last question, what is the best way that family members can be supportive?
I think that every person has a different need. I think being there is number one. So if the family members are able to be there for the patient, that is number one and almost probably the best thing they can do. But ask the patient, what can I do for you? What can we do to help you out? It could be, again, giving them a ride to the doctor. It could be helping them with the dishes. It could be something related to work or school. So I mean, there's so many ways of helping somebody.
So just
being there for them, emotional support, and being positive, because this is something that most people actually get through.
Thank you so much for your time. We really appreciate
It's a
your
pleasure.
support.
Thank you.
Everybody's been down, hit the bottom, hit the ground. Ooh, you're not alone. Just take a breath, don't forget, hang on to what's promised.
As some of you know, my mom was diagnosed with metastatic breast cancer last November. So today I just wanted to take some time and share with you some things that have helped my family and myself make it through this past year. My first piece of advice would be to just live day by day. As hard as it is, try not to think about tomorrow, the next month, or the next year. Just live in the moment, spend as much time as you can with your family member or friend, and be thankful for the time that you do have with them. My second piece of advice would be to be strong. Let your family member or friend know that you're there for them, that you're just a phone call away, that you'll go to their doctor's appointments with them or take them wherever it is they need to go, and that you'll be their advocate during this journey. My last piece of advice would be to just believe and trust.